Welcome to the Spinal Truth Show, weekly podcast edition. I'm your host, Dr. Caleb Slater, and there's somebody else with me. Name is Chris.
That's me.
Look at that.
Wow.
Look at that introduction.
I just tried the mushroom coffee.
Mushroom coffee. It's not bad, right?
Honestly, I mean, just
one more sip.
No, it's pretty good, actually.
Life Boost mushroom coffee, and we are not sponsored, by the way. I actually drink Life Boost, but it's like super expensive.
Is it?
But it's supposed to be like organic and clean and no heavy metals and toxins and stuff like that. Whether or not that's the case, and they also have this mushroom decaf coffee because I do one regular cup a day, and then I do like one or two of the decaf because I like coffee and I like holding this warm, dark liquid in my hands.
I do have one critique for you.
Okay.
Because right before we started the podcast, too, you're like, there's plastic and blah, blah, blah.
Yeah.
You're making your expensive coffee in a Keurig, which is all plastic.
No. The Keurig is metal. It
was metal, okay.
Oh, yeah.
Sorry. I was going to say, why don't you do like a French press or something, or a pour over?
I do like a French press.
Because those are definitely
but it's
clean
pain
options.
in the ass.
Yeah, pain in the ass. But you're always already going to the...
Yeah. But no, it's metal.
So now when I drink this, I will be transformed.
Yeah, lion's mane and whatever, and ashwagandha or whatever.
Yeah, I take ashwagandha every day.
Well, look at that.
It's supposed to help with my cortisol, stress levels.
How's that working out?
Honestly, it's only been about a week and a half where I've been regularly taking it. So I've been sticking with it. We'll see. I have a hard time sticking with things.
And that's a good theme. I've been saying this recently. If you've been doing something for 4 to 6 weeks and you're not seeing a change, it's probably not working.
Yeah, it's hard to tell with vitamins though, right?
It is. No. So, and actually one of the ways that they tell you to tell this is with, I always mess up this name. Chondroitin, I always mess up the name. But basically for like your joint health, right? Mm-hmm. They tell you to take it for like 3 to 6 months, and then they tell you to stop taking it and see if there was a change. And if there was, maybe it was helping.
Just take it.
Yeah, right, like.
So I just take it.
Yeah.
I mean, if you can afford, obviously, if you can't afford it, don't do what you got to do. But like.
Well, in general, you should get your vitamins from your food, not from your. But you can make an argument that our food is less nutritious than it was, and blah blah blah. But
yeah, you can't win.
So hamstrings.
So hamstrings are a thing. I don't know if I've ever had real issues with hamstrings, so I'm kind of excited to learn a little bit more about like what the common things are.
Well, you are gonna learn. And before we get started, make sure to like and follow us on TikTok and Instagram and YouTube and Spotify. If you want to reach out to us with questions, TikTok and YouTube and Instagram are great avenues. You also have info@thespinaltruth.com if you'd like to email us.
Yep.
So hamstrings. Stop stretching your hamstrings. There's going to be the caption for this episode. Stop stretching your hamstrings. In general, so if you have a problem with your hamstrings, stretching is what you're told to do, right?
What does that look like?
Like a runner stretch, like leaning forward, bending down and keeping your knees straight, bending down, stretching your hamstrings, stuff like that.
So stop stretching your hamstrings even if you before or after a run? Like that's all I've always heard.
So I would actually, all right, now that's going to be a longer explanation. But I would rather work on your spinal mobility before and after a run, and I'd also rather work on getting your hamstrings to contract through full range.
Okay.
Here's the thing. Have you ever had a tight muscle from doing too much?
Sure.
Normally a bicep or a pec, right?
Yeah.
You have that tight muscle. It hurts when you use it, and it feels like full and heavy, and it feels stiff.
Yeah.
You stretch it. When you stretch it, what happens?
It loosens?
It gets better.
Yeah.
How long does it take to get better?
Not right away.
Pretty much right away. So you got that one wrong.
What do you mean? So
if I truly have a tightness, let's say my biceps. Let's say I went to the gym, I cranked out a bunch of bicep curls, and later that day or the next day,
you feel the tightness.
I feel that tightness. And that soreness.
Okay. I'm sorry. I was thinking. All right.
Right. Now somebody shows me how to stretch that muscle out properly.
Yeah, and you loosen it,
and it feels better. It feels like 70% better right away.
I was more thinking of the DOMS kind of thing.
Not delayed onset muscle soreness, just stiffness from working out, right?
Yep.
It feels significantly better right away. And then within another day or two of doing that stretch, it is absolutely better.
Yeah.
So why do we not have that mindset for your hamstrings? Why are we like, well, you're just gonna have to stretch your hamstrings out like 2 to 3 times a day for the rest of your life, and you're not gonna make any progress?
I don't know.
I don't know either. But I know why people aren't getting better.
Yeah.
Because most of the time, it's not their hamstring in the first place. Their symptoms aren't actually the tightness that they're perceiving is actually nerve tension.
Okay.
Okay? The symptoms that they're getting with their hamstring, which is anything from weakness to fatigue to cramping and even to tears, is actually from an underlying nerve issue.
Would a failure count as like a weakness?
Yeah. Right.
Okay.
So all right. Your sciatic nerve innervates your hamstrings.
Yes.
For the most part, there's a small branch from your obturator nerve, but the sciatic nerve is by large and away innervating your hamstrings.
Okay.
That nerve signal gives your muscles direction. Tells it when to contract, when to relax. That contraction, relaxation, that helps your muscle perform, and it also helps it heal. Okay. Helps it recover. If that signal is diminished in any way, you won't have as strong or as ready of a contraction, so it'll be a little bit slower, right? And that, that could be the difference between you winning your race or breaking out from the defender or whatever, versus not. Football season's coming up, so I'm pretty football focused here. Or over time, your hamstring's not recovering. So you worked out, you practiced, you had a game, and now you did that again the next day, and again the next day. And over time, whereas your hamstring would recover, it's not, because it's being increasingly fatigable. You're not getting that full recovery, and now you're setting yourself up for failure.
Which could eventually lead to
a tear.
Yeah. Okay. So is it common that hamstring issues are with athletes?
Yes, very common.
But can you have hamstring issues if you are not as active?
Yeah, and most of the time that hamstring issue would just feel like a lot of tightness.
Gotcha.
And so you'd be like, I just constantly feel like I have to stretch my hamstrings out. And again, if it's tightness, stretching works right away, significantly.
So if you have a tight hamstring and you stretch,
it should feel significantly better afterwards.
Okay.
And then if you continue to stretch it for a day or two, it should feel damn near 100% better.
Gotcha. So is it more of the activities that require the explosive use of the hamstring?
For what?
Well, like you were talking about, like football and stuff, where it's not like you're just jogging. It's
like sprinting. Sprinting's a heavier use, launching, right? Yeah. But what a lot of people don't realize is that when you run, your lower back is actually an extension. It moves into extension. When you sprint, it moves more into extension. And then also too, when you sprint, when you run faster, you're separating your legs more, so you're putting tension on your sciatic nerve. So your back is in this, we'll call it extended precarious position, right? And then your nerves are fully stretched. That you could easily see how that's a way to piss off your nerve. For example, a lot of people that have like sciatic nerve issues or even hamstring issues that are sciatic nerve related, especially if it's in their right foot, they notice it when they drive. Because driving is a nerve tension position. Yeah, okay. If you put your legs straight out, you're in a slump position, and you bring your foot back, you're pretty much at close to max tension on that nerve. When you run, especially when you sprint, same thing.
So, semi-related here, you don't run, right?
I'm not a runner.
So what is your preferred exercise? Like, what do you think is the best exercise to do?
Best is subjective, right?
Sure.
Some form of weightlifting that has some form of cardio in it. So HIIT is real popular right now. I kind of like circuit training. For me, it feels like it breaks it up a little bit.
So what, you do push-ups then pull-ups,
I do,
sit-ups,
exactly. I go from this station to this, or from this activity to this activity to this activity, and then you do it again. And maybe you do a few rounds of them.
All that stuff you're describing, though, is nearly impossible for a beginner.
No, because you make modifications. Okay. I mean, so push-ups, you go from your knees, or you go on an inclined surface, right? Okay. Squats, you don't go down as far, or you don't use any weight. Sit-ups, you start with crunches, or you put your feet up on a ball, or you do some modified ab workout, like you do bridges instead temporarily. Like you can modify anything.
So how many circuits how long do you do this for?
Well, it depends. Right now I do a Murph. So it's push-ups, pull-ups, and squats. So I do 20 rounds of 5 pull-ups and with a weighted vest. And then you do push-ups, and then you do squats. And it's a 1-2-3 ratio. So 5 pull-ups, 10 push-ups, 15 squats.
You do 20 of those?
Do 20 of those.
I think if I did that, I would be in the morgue.
Well, when I first started it, I was only doing like 50% of it, and with no weight, right? And then after a few months,
it's gotten much.
Yeah, now I'm doing, and the workout partner I was working out with was actually using a band for the pull-ups at the beginning, and now he's on a 32-pound weighted vest.
Wow. Okay. All right. Just curious. My own curiosity.
How did we get on that from hamstrings?
Well, we were talking about exercising and running and all that stuff. So like those kind of exercises you're doing there, though, probably wouldn't be
not a lot of hamstring.
Yeah,
squats, you get some hamstring. But.
Gotcha. Okay.
So if you have tightness down your leg,
yeah,
almost always it's actually nerve tension. Okay, it's not a tight hamstring. If it is a tight hamstring, for the most part, stretching it makes it feel better immediately.
Okay.
Another thing, all right, so there's kind of two components here. It's either a muscle problem or a back problem, or it could be both, okay? The back problem could have led to a muscle problem. So let's say the muscle problem, for ease of terms, it's a weakness issue. Mm-hmm. So let's say it's a weakness issue in your muscle, and you're going to the gym and you're strengthening, and you're doing your hamstring curls, and you're doing your split squats and your Bulgarian, split squats, and you're doing your RDLs and you're doing all your hamstring stuff, right? But your hamstrings aren't improving as much as other areas. You're not seeing the same gains. You're not able to put up as much weight. And again, we're correlated, right? Let's say I start with 10 pounds with my quads and 10 pounds with my hamstrings, and then 2 weeks later I'm at 50 pounds with my quads and I'm at 20 pounds with my hamstrings, right? Like, I'm not seeing those same gains. I also feel like I fatigue. Like, I can do a set with my quads and then 30 seconds later do another set. I do a set with my hamstrings and then like 10 minutes later I'm still like, man, I still feel it. I'm still not feel rested, right?
Yeah.
All signs of a nerve issue. Okay? And that could be why you're not able to actually strengthen your hamstrings as well, because that nerve signal isn't fully there. And step one would be turning that nerve signal on, finding out where pressure is on that nerve, taking pressure off of it, restoring that full normal signal. And now you might not even need to strengthen your hamstrings, but if you do, because it's been a long time,
it'll be effective.
Yeah. So that's an approach that I take.
Yeah.
Let's say it is just a muscle issue. Mm-hmm. Okay? Muscles actually need to contract. That's how they move blood flow. That's how they remodel their tissue. That's how they stay or become healthy. Okay? Stretching normally doesn't really do much for a muscle unless you overused it and now it's tight. But for most people, that's not the case. Additionally, muscles need to contract through their full range. So for your hamstring, that means bending your foot all the way back to pretty much touching your butt, and then actually extending your leg back further to get that upper portion of your hamstring.
Gotcha.
Most people don't do that. Most people can't do that. Most people can't stand, bend their knee fully, and then extend their hip a little bit. They would cramp, and they either wouldn't be able to get through full range because of weakness, or they would cramp because of weakness, deconditioning, or nerve issue. Thank you for watching the Spinal Truth Show. I hope you're finding this information helpful. If you're out there and you're still in pain and you're looking for relief, we have some solutions for you. You can schedule a consult with me or a session, but if that's not in the budget, we also have some options that are self-guided at home. You can go to thespinaltruth.com. We have courses set up right now for arm pain as well as for neck pain. They are geared towards you. They are a 4-week course, 60 videos that are self-guided by an expert in the field that you can do from the comfort of your own home at your leisure. They will take you through step by step the typical approach that I take with patients. The expectation is that they will provide significant relief over these 4 weeks. So if you're looking for something better, something different because you're not finding the relief, go to thespinaltruth.com, sign up for one of these courses, and get the right treatment, see the difference.
How do you get a muscle problem versus a nerve problem?
Okay.
Like in your hamstring.
How do you tell, or how do you get one?
Both, I guess.
All right. How do you, I mean, you can get a muscle problem by not using it, and you can get a muscle problem by overusing it or misusing it.
Okay. Or trauma of some sort.
Yeah, trauma's less likely to the
Okay.
hamstring. And I mean, like, you're talking about a tear.
Yeah.
If you're talking about a trauma, but like, you got the tear because you were using it, right?
So it's either you're not using it enough and then you go to use it and it's like a problem.
Yeah, or you're overusing it.
Okay.
Yeah.
But a nerve, that's a little, longer to reflect?
A nerve, you can get it from trauma. A nerve problem to the hamstring. You can get it from being sedentary. You can get it from tension on that nerve from other areas. Like your piriformis muscle can actually put tension on the sciatic nerve and cause sciatic nerve symptoms, which could include the perception of tightness in your hamstrings or pain in your hamstring area.
How long would it take for you to if you had a sciatic nerve issue for it to present?
I mean,
you know what I mean? Like,
it would present right away.
Oh, it is?
Pretty much.
Okay.
I mean, if you put pressure on your sciatic nerve, if you irritate your sciatic nerve, wherever that sciatic nerve goes, you could have immediate symptoms.
Okay.
And the immediate symptoms would be pain, numbness, tingling, weakness.
Gotcha.
Feeling of fullness, feeling of stiffness. You'll have people that they'll say that they feel like hot or cold, like running water down the back of their leg. That's a nerve issue.
Okay.
The whole point of the podcast and the whole point of what I do is just trying to shed light on, hey, the reason you might have your chronic hamstring tears, right? Like Keenan Allen. And you know, and this is going to be a great example. So Keenan Allen's a wide receiver for the Chargers again this year. I think he went to the Bears last year, and now he's back on the Chargers with his original team. Mm-hmm. He has chronic hamstring issues, right? He had a hamstring problem one year where he was not playing, and then they were on a bye week, and he wasn't, he rested it during the bye week, and his hamstring problem got worse.
Oh.
There's no reason that a muscle would get worse with rest.
Right.
For the most part, right? But a nerve,
he's got a nerve
could
problem.
easily get, and that also, by the way, explains your chronic hamstring problems. You know, why don't we get this? Why don't we get this with a lot of other areas? Why don't we get this with your quad as much? Why don't we get this with your bicep or your pec as much? Like, why are chronic hamstring tears so? And you can make arguments about the use of it or the difference in strength ratio to your quad and your hamstring and stuff like that. And all that probably has validity. But for me, one that has equal and maybe even more validity is that the sciatic nerve is one of the most commonly irritated and involved nerves in your body, and it primarily and directly innervates your hamstrings. Mm-hmm. So that makes sense to me why your hamstrings are more fatigable, more likely to tear or have chronic reoccurring problems, is because when that happens, you get treatment to your hamstring, you focus on recovery on your hamstring, and you don't actually treat the underlying problem.
How does a football player with an expert medical staff not realize that it's a nerve problem?
We got a lot wrong in the medical world. It's so much. I wrote my book, The Spinal Truth: A New World of Medicine, and in it I pointed out a lot of what I see that I feel like is wrong and flawed in the medical system, and it's anywhere from the system itself to your 5 to 10 minute appointments with a doctor, to the over-reliance on pain medication, injections, steroids, to diagnosing, to relying on diagnosing based off of imaging, and then kind of not looking at your body as a whole. If you go and you say, I have knee pain, they look at your knee and nothing else. I have elbow pain, I look at your elbow and nothing else, and not looking at your body as a whole. And you would think that these high vaulted, professional team doctors are different, but they're not. They have the same general breadth of knowledge. Are they at the top of their field? Did they work a little bit harder? Did they know somebody? Was that the track that they went on? But does that mean that they are any better than anybody else?
Well, clearly not if he's still experiencing the same thing over and over again.
Yeah, and again, I see this so often, right? And all you have to do is just take a second to actually screen the spine, watch them move, put some pressure on the areas of the spine, see if there's pain, see if there's stiffness, see if there's limited motion. If there is, treat it and see if the symptoms get better. I feel like that's a really reasonable approach that we don't take.
Yeah. So we opened this podcast with, you said, stop stretching your hamstring.
Stop stretching your, because again, if you've been stretching your hamstring and it's not better by now, it's not the solution.
Right. So, but
if you sorry to interrupt, but
Yeah.
if you had some hamstring problem, and let's say it was stiffness and you stretched it and it was better in a day or two, you're not watching this podcast.
that was going to be my point. If you're stretching your hamstring and it does work,
You're not watching.
then you don't need to stop stretching your hamstring.
Because
Because
you already stopped.
Yeah,
Yeah.
Yeah. Okay, so the hamstring stuff, we're talking about a lot of runners, I assume.
Yeah. Runners,
And-
sprinters.
So I know runners, they'll have, well, you got to wear your special toe shoes and all this kind of shit.
So I've tried I've tried like the Vibrams toe shoes.
Yeah, that's the thing.
I've tried a bunch of different inserts, Super Feet and
inserts,
Power
yeah.
Step, and I've tried like different soled bottoms, like the Hokas, the rocker bottoms, and I've tried all that stuff. And this is all kind of more for like foot pain.
Yeah.
You know, I found none of it to really work. And
Well-
I have reasons why and rationale and stuff like that, but clinically for my patients and then for me, it either didn't work or it didn't work enough or it only worked temporarily and then stopped working.
So if you are a runner and you are experiencing hamstring problems, do you stop running?
No, well, I mean, it depends on the symptoms, right? But what you do, you first look to your spine. You see if there's so running is an extension moment of the low back. We talked about this relatively recently where I feel like a lot of people's lower backs are actually stuck into extension, and that extension moment compresses the sciatic nerve, compresses the nerves, right? And this over-compression of the nerves over time diminishes the signal, irritates the nerve, puts pressure on the facets, so the bony structure, puts pressure possibly on the disc, and moving in the opposite direction takes that pressure off, restores the signal, restores normal mobility to the low back.
Well, that was kind of my thought process along with talking about the shoes and the inserts and all that stuff. None of that changes the fact that you are, while running, in an extension movement.
No, none of that's going to change anything.
And if that's what's ultimately...
But you'll get a lot of this. And again, everything I'm telling you not to do, I have done, right? There's a lot of people out there that if you had lower back pain or hip pain when running, they would look at your feet.
Yeah.
I've done that. I went to courses for that. The first course my wife and I ever went to, my wife's an expert physical therapist, we went to when the foot hits the ground, everything changes. First course I ever went to, 2008.
That's a good memory. How do you remember this?
It was the year I graduated.
Okay.
Yeah. So, and then I've also went to a barefoot short foot training course. So these are weekend courses, you know, just looking at the biomechanics and the effects of the feet and blah, blah, blah. And by the way, when you go to a course, what you should do is you should come back and you should probably over-apply everything you learned to your patients for the next 3 months. And that's what I would do. I would see who it worked for, who it didn't. I'd try to troubleshoot it. Like I'd really give it its day in the sun. I'd give it its due diligence, right? And I tried the same thing with inserts and footwear and stuff like that. And at the end of the day, your foot pain is for 2 different reasons for the most part. Number 1, it could be your spine. And I know I say this a lot, but it absolutely could be your spine. And number 2, it's because your foot is probably stiff and weak.
Okay.
And most of the time it's stiff because it's only bent backwards. When you walk, you bend your foot backwards and you bend your toe backwards. When you put your foot in a shoe, you're stuck in either neutral or bent backwards.
Yeah.
You never curl your toes fully the opposite direction. That curling your toes, number 1, takes pressure off of everything that you were putting pressure on by bending your toe and your foot backwards. So everything you were compressing. Number 2, it also contracts your muscles in that opposite range. So like the bottom of your feet you should be able to curl your toes really strongly, full range, and like hold it there without cramping. Most people can't. Hey, just a quick break here and then we'll get back to the show. If you're out there and you want to see if this is the right approach for you, you can schedule a consult or a session with me. Go to thespinaltruth.com. At least set up a consult within 30 minutes. I will listen to your symptoms. I will go over your history. I'll go over what the approach I would take for you and the results that I would expect. My goal is to save you from continued pain, failed treatments, and prevent you from getting surgery. So go to thespinaltruth.com, set up a consult, and let me go over your symptoms. Now let's get back to the show. You have to take your shoe off.
Oh.
You have to curl your toe.
I don't give that stuff away for free here, my friend. But yeah, no, that's actually an interesting thing to try, right?
Yeah, and again, so there's people out there that would look at your feet to fix your hamstring or to fix your back or to fix your running.
Right.
And I've done that. And I've done the same process with your knees and your hips and even your arms, like the way you swing your arms and stuff like that.
Well, so we often talk about different physical therapy methodology, I want to say, and your standard physical therapy treatment versus your McKenzie or your Maitland. Look
at you knowing all those
I know,
terms.
look at me. But do McKenzie or Maitland, do they treat a hamstring differently than standard physical therapy would, or is it about the same?
Nah, it's closer to the same.
Okay.
Yeah, if you went in and you said I have a hamstring pain, especially if you had a tear, and the tear you do need to allow it to heal and,
Sure.
and remodel it and stuff like that. But let's say you went in, you're like, I had a tear 3 months ago, but I'm still having lingering symptoms. Some McKenzie therapists would take a look at your back.
Okay.
Probably not all of them. Probably very few Maitland therapists would take a look at your back.
So if you are dealing with a hamstring issue and the stretching obviously didn't help, and they're not looking at your back, what should you do? Is there anything you can do besides advocate?
Well,
for them?
you know what? Yeah. So I hate saying see me, either in person or over telehealth. I hate saying that I'm the one that you should see, although that's an option, right?
Sure.
But if you want, go to a McKenzie therapist and tell them that you heard from an expert that your lumbar spine isn't flexing enough and you want to work on lumbar spine flexion and see if that changes your symptoms. And they probably won't do it the same way I would do it. But and they might not even listen because nobody likes to be told what to do. But maybe that's your best shot.
Okay, that's a good advice there. If you are someone who is a runner or an athlete and you're not experiencing hamstring problems now, would it be a good idea to incorporate some sort of lumbar?
100%. Yeah.
Okay, yeah.
What you need to do in life to stay healthy is to just undo the things you do too much. For the most part, for your upper back, we look down too much.
Yeah.
So for your upper back, when you work out or when you do some just health stretching, right? You should stretch the opposite direction.
Yep.
For your low back, surprisingly, your low back's actually in extension a lot. When you lie on your back, your low back's in extension. When you lie on your stomach, your low back's in extension. When you lie on your side, unless your knees are all the way up, your low back's in extension.
It sounds weird because I feel like I just want to bend my back backwards to make it feel better.
Yeah. A lot of people feel that way. I can't tell you how many people I've met talking about the hamstring where they're like, I just feel like I need to stretch, and they just keep stretching and stretching.
Yeah.
And what you're doing is you're actually pissing off the sciatic nerve over and over and over and over and over again.
Yeah.
And a lot of times people are scared to move their back the other direction, into flexion. They were told not to bend over. They were told not to move it, right? But for the most part, when you walk, when you run, your low back is in extension.
Yeah.
When you sprint, your low back's in even more extension, right? When you stand, your low back's in extension. There's not a lot that we do these days where your low back is in flexion. And I know people are going to say sitting, but I actually disagree with that. I've explained in other podcasts why. But I think for the most part, and one of the reasons is now most chairs have lumbar extension built into them.
Yeah.
So if you're sitting in a chair, every chair in this room has lumbar extension built into it, and that wasn't the case 30 years ago.
That's
right?
true. Why is that? Why did they
Because we said it was good for your low back to be like this, so we were like, so we over-applied it.
Gotcha.
Because it's not good for your low back to only be an extension. It's good for your low back to change positions, just like it's good for your elbow to change positions or your knee to change positions. Your knee should go all the way straight and all the way bent, and it should do that multiple times throughout the day. So should your spine. You should go all the way back and all the way bent. You should do that multiple times a day, but most of us don't.
Yeah.
So what you need to do in order to stay healthy, so like this came from you asking the question of, let's say you're running and you're not having hamstring issues.
Yeah.
I'm assuming your question should be, well, should you still work on your back?
Yeah.
Absolutely.
Yeah.
Because when you're running, you're doing a lot of lumbar extension. Then you're going to go and you're going to lay down or sit for a while, and you're going to be in extension. You're going to walk or stand for a while. You're going to be in extension. Then you're going to go to bed. And unless you sleep on your side with your knees all the way up to your chin, your low back is in extension. So if you want to like take pressure off, and it makes sense. Like if you took your finger and you just bent your finger backwards, right? And then you just kept doing that, and you never let your finger go the opposite direction to like a full fist. How do you think your finger would feel?
Not good.
Not good, right? After a while, right? Do you think when eventually, in like a year, when I was like, okay, now you can make a fist.
It'd be like,
how do you think that would
so
feel?
painful, yeah.
It would be so painful, right? And that's the case for so many people. So you need to know how to do it. You need to know what to look for. You need to know the best ways to do it for you, because some people can start at level, let's say, 3, and some people need to be level 0 or 1, right? Some people can progress force more quickly. Other people, they need to stay with what they're at for longer. Like you should have some guidance with this. But to make it very simple, your back absolutely needs to move into full flexion and be strong in that range. For a lot of people, that's not the case, and for a lot of people, I see that is the underlying cause of their reoccurring hamstring pain, stiffness, or tearing.
Can you get hamstring issues or pain because it is compensating for something else?
Sure.
But the treatment would essentially still be the same?
If it's compensating for something else, you need to work on that. So let's say your glutes. Let's say your glutes aren't strong, okay? And your glutes are a hip extender and your hamstrings are a hip extender. So if your glutes are weak, let's say your hamstrings are taking up more force and your glutes aren't supporting this movement, you can make a good argument that that's what's causing your hamstring issues. If that's the case, though, strengthening your glutes for about 4 to 6 weeks
make your hamstrings better.
Will pretty much make your hamstring pain go away.
Gotcha.
Right? So if you're out there and you've tried that approach, and you gave it, if you do like one exercise every other day and you're not really doing it to full force, and that's not enough, right?
Yeah.
But if every day or almost every day you did a really good set or two for your glute training, strengthening, you gave a little bit of rest to your hamstrings during this time, you did this for about like 4 to 6 weeks consistently, okay, you should be better.
Okay. Hamstrings don't sound super complicated.
At the end of the day, it's muscles and tendons, right?
Yeah.
And they have a very defined job. We know how to make them better. But the weird thing, and what I mean by that is muscles respond to contraction and appropriate load through their full range. That's how you make a muscle super healthy, right? Through its loaded progressively through its full range. Fully extended, fully lengthened, and fully shortened. The problem is that most of the treatments don't do any of that. Most of the treatments work on just stretching it, resting it, strengthening some muscles around it. Or if they do strengthen it, they don't do it through its full range. Or they miss the spine component.
So if you aren't getting the proper treatment for your hamstring, it can lead to a tear, obviously, but also can it progress somewhere else?
All right, so maybe this is a good segue to how to tell if it's a hamstring or a nerve issue.
Yeah.
Okay, we talk a lot about this. All right, hamstring is a muscle tendon, right? Muscle tendon has a job and has a function.
Yep.
If you're just sitting there, okay, your hamstring and tendon are actually on slack.
Yeah.
They should not be hurting.
They are not.
If they are hurting when you're not using them, that is a high likelihood that they are not the problem.
Yeah.
Much higher likelihood that it's your sciatic nerve. So pain at rest. If you have pain when you're not using your muscle and tendon, then it's probably not your muscle or tendon, right? It's probably not your hamstring, it's a nerve. If you have pain outside of where your muscle and tendon goes, so for the most part, let's say the middle part of your butt to the top of your calf is your hamstring. If you have pain down into your calf or into your foot, you do not have a hamstring issue, okay? If you have pain up into the top of your butt or your low back or the outside of your hip, you do not have a hamstring issue. You probably have a nerve issue. Okay, so pain outside of where the muscle or tendon is.
Okay.
If you have symptoms on both sides, it's more likely that you have a nerve issue, a spine issue, than you have a muscle or tendon issue. You know, and let's say you did a huge workout, you haven't done it in a while, and you have soreness. You know, that's normal soreness on both sides.
Yeah.
You're having pain and symptoms, and it's not going away, and it's on both sides. It tends to lead towards back.
Gotcha.
Right, back, spine, nerve. If you have numbness or tingling, you absolutely do not have a hamstring issue. You can make an argument of there's something called hamstring syndrome, which is a compression of the sciatic nerve due to your hamstring. Either way, that's still a nerve issue, but and I also think it's overdiagnosed. But anyway, so if you have numbness and tingling, you absolutely do not have a muscle tendon issue.
It's a nerve issue.
It's a nerve issue. I'm sure there's another one that I'm forgetting, but that should help you. That should help you, like you pain at rest, pain on both sides, pain outside the area where your muscle is, and numbness or tingling, you have a nerve issue.
If you have a hamstring issue and you've been dealing with it for a year and you're going to PT for months and it's not getting better,
that's another sign. Seriously. And
Yeah.
that's treatment to that area that's not treatment to that area for that problem. You're either getting the wrong treatment to the wrong area or for the wrong diagnosis.
Yeah. And it sounds like for the majority of these, what a Jefferson curl is probably what.
Yeah. So
Will
just
help.
progressive lumbar flexion.
Yeah.
I really like the Jefferson curl. Again, you need to know how to do it. You need to know what to look for. You should have a proper screening to make sure that you're healthy, you know, and you're like it's. I'm losing my words, but that it's right for you.
Sure.
But for most people, it is.
Gotcha. On a other note,
Back to the
just
mushroom
about
coffee?
done with my mushroom coffee.
What are we
I will
thinking?
say, I feel like every single neuron in my brain is now firing.
Wow.
Yeah.
Yeah, you're recalling names and.
If I did my SATs right now, I would have a different future ahead of me. I'll tell you that. But can't go back.
No. If only you had this mushroom coffee from Life Boost. Do we think, if we say it enough, do we think we?
I don't know. Life Boost does seem to be pretty good. I would like to have more and try this.
So I'm actually a Wawa fan.
Are you?
Right?
The
Like I
coffee?
actually like the taste of Wawa coffee, and I think it being in those urns for a while, for whatever reason, like it just, you know,
it's just
like soup,
maturing,
cooking, maturing, you know, like right. That
steeping.
being
That's the word.
yeah, like so. I actually like the taste, but I'm like guaranteed, and I looked this up, that there are some, that there's it's not organic, right? Like there's more metals or toxins or mold. Like mold's a big one for coffee, right?
Yeah.
And then also too, the cups that we talked about, like they're lined with plastic.
Yeah.
So I was like, all right. So I tried to look for coffee that was organic and mold free and toxin free and stuff like that, and that's what came up, and I tried it, and I tried some other ones, but I like this one.
Yeah. No, it is good, and I think there's probably an element to the Wawa things is that those
The crafts
are probably like very rarely actually cleaned, so everything is just flavored.
Right.
You know what I mean? And it's not like it's not probably still safe because the coffee's hot, but all that. This is decaf too.
That's decaf.
Yeah.
You get some, like, you're supposed to get some energy from the mushroom component of it.
I don't drink coffee necessarily anymore just for the energy, anyways.
Well, and so yeah, I'm doing it for like the
Especially
taste
now
and like,
at this time.
it's weird to say, but like the ritual of it, right? Like
It's just something about well, it becomes a normal thing. I don't know, the ritual aspect. Yeah, this is good. I like it. If I had a hamstring issue, I don't know if it would help it.
I mean, but you should try. But if it's not helping in a few weeks, then it's not the right treatment.
Yeah.
Right?
Super. What is it?
Life Boost. Life Boost. Mushroom coffee.
Okay.
We are not sponsored. I don't know if we'll ever do sponsors.
Well, it depends on if they come and they say, "Hey, we'll give you an endless supply of Life Boost coffee, I'll probably...
We'll sell out for an endless supply of Life Boost.
I mean, do I get to get some too?
Well, of course, if we're getting...
Well, then, yeah, we'll sell.
Well, you're voting sell out?
No,
we'll sell out for coffee.
Sell
It is
out.
expensive. So,
Yeah, no.
all right, so that's our show. Hopefully we gave you something to think about, something about hamstrings that you didn't know before, and maybe something to try for yourself. If you are looking for more guidance, more direct guidance, maybe from myself, you can go to thespinaltruth.com. You can schedule a consult with me or a visit. I'll go over your symptoms, I'll go over your history, your movement, and I'll give you some guidance on what to do or what I would do for your condition, for your symptoms. Please make sure to like and follow us on TikTok, Instagram, YouTube. We're on Spotify as well with this podcast. And stay tuned next week for more amazing content, and hopefully next week sponsored by Life Boost.
We'll see what happens.
All right.